Yes, to all the QESP technicians, to make sure that we help keep you safe and so you can do work and help people, recognize that you do not need to diagnose people. Diagnosis is the practice of medicine. We don't want to do that. Now, always work with doctors, refer to them in the beginning, in the middle, and the end. Try to network with them. Certain of them are assholes and you can't network. Try to find friendly ones, but always work by referring. Explore the patient's past doctor network and get to them. Our form tells us clearly that we are not diagnosing or treating diseases. We're diagnosing, helping people. We don't need to diagnose anybody, actually. We're just dealing with people. Stress is a viable disease. It's been contained in the ICD. And here is the new 2020 number for stress, Z73.3. This is stress. This is the international classification number to help get insurance. Diagnosis is all about getting insurance payment. And stress is the medical concern. You can work with stress. You can always work with stress, working with entwinement, subspace prayer. And now let's talk about stress a little bit more. Let's talk about diagnosis. And let's get to a review of Dr. House.
The pharmaceutical people have developed synthetics, but we now know that a synthetic anything is an insult to the body. We do not want to insult the body unless we absolutely have to. Once a patient has been given a synthetic drug or any type of drug from his medical doctor, please do not interfere with that sacred relationship. You might be able to help talk to the patient, but it's between the patient and the doctor as to what they do with that relationship of whether they're going to take that prescription or not. The doctor and the patient should look at this. You might be able to offer advice and say, maybe let's try something natural, but you need to do that with the doctor because this is very critical to be able to work with the medical system, not against it. As I've told you in many of the other interview processes, we always want to have a referral. We want to refer our patient to the medical doctor. It's the medical doctor's job to do the diagnosis.
You see, we really don't need to diagnose. Yes, it can help, but we need to leave that diagnosis to the doctors who are licensed to do it. As a biofeedback person, you're here to help with their lifestyle, help with their stress. Leave the diagnosis to the doctors. Let them do the guessing.
If we look at House, we're going to see how they struggle to do diagnosis episode to episode to episode. That's how they work. And you can see that with virtually every patient that they do see, they always get the diagnosis wrong.
Mebendazole can cause adverse effects, but nothing like this.
He's been off him since yesterday anyway.
Long passes, wild guesses, anything.
Hypopituitarism could cause multi-organ failure.
His thyroid hormone wasn't completely normal.
Those threadworms, why would his body have gone to hell just hours after they were gone?
The worms weren't hurting him, they were helping him. He has extraintestinal Crohn's. He got it from being raised in too clean, too overprotective of an environment.
It's the hygiene hypothesis, why there's so much autoimmune disease in the developed world and almost none in the developing world.
The worms were keeping the Crohn's in check, teaching his immune system what it should have learned from eating dirt growing up.
Once you killed them, it started killing him.
So his life of filth wasn't the problem. The clean living was. Let's start him on methylprednisolone.
And some helmets.
Worms. Cool, huh?
Yes, this is the best way to strengthen your child's immune system. And this is the best way to really get the immunization. This really is the best way to start to immunize your child. Louis Pasteur was not a medical doctor, he was a microbiologist, and he was the first. He started to really discover that there was bugs, and then they got into germ theory, but on his deathbed he realized it's the immune system that's more important than the germ. We can deal with this. Now let's learn about how we deal, and we do not diagnose, and let's learn why.
Ready to save some lives?
Killing me.
We spent a week doing top of head in anatomy. I know just where it is.
That's not the top of my head.
Yeah, close enough for clinic. Your sinuses are clogged. Judging by the scratches on your hands, I'm guessing a new cat.
Yeah, it was my mother's. She's dead.
You keep a dead cat?
No, my mother's dead.
Oh. Poor cat. You're allergic. We can control it with antihistamine. 1 pill a day.
Pills?
You don't like to swallow. Not surprised. Forget the pills. I'll give you a nasal spray.
Steroids? Is there something else you can give me?
Well, if you live by the river, I've got a bag.
Wait, you thought I wouldn't agree with him? Ever?
Well, you didn't agree with him. That's why he dumped you. Oh, sorry. It was mutual.
We're cool, okay? Nobody's angry, nobody's hurt.
Sounds passionate.
TTP makes sense to me.
Not to me. What if you had a history of...
One big happy family. TTP it is.
Confirmed with blood smear and Adams TS13 antibodies.
I look like an idiot?
No. Why don't you show me how your inhaler works? You're stupid.
Well, I'm rubber, and you're glue.
He's not pedestrian. He's stupid. At least stupider than he should be. He's a DXM junkie.
Dextromethorphan, as in cough syrup?
Wasn't taking it for his cough.
Why are you giving Adler steroids?
She's my patient. That's what you do with patients. You give them medicine.
You don't prescribe medicine based on guesses. At least we don't since Tuskegee and Mengele.
You're comparing me to a Nazi? Nice.
Brandon's not ready for surgery.
Okay, well, let's leave it a couple of weeks. He should be feeling better by then. Oh, wait. Which way does time go?
The man's in a coma.
He didn't mind. I asked.
You're getting crumbs all over him.
Your girlfriend called the clinic 15 times looking for you today.
Ha. A lot to discuss. China patterns.
House. She's a stalker.
Right. Couldn't be that she finds me interesting, attractive. Has to be that she's insane.
She's called you 15 times. Your mother's not that interested in you.
Well, maybe I'd be better adjusted if she was.
It's usually worst in the morning, especially if I've slept on my arm. If I sleep on my back or with my arms out, I'm usually okay.
So your arm only hurts after you lie on top of it all night?
Yeah.
Well, have you thought about, I don't know, not doing that? I'm only gonna take little tiny pieces.
Tell what?
Till I find the problem.
Or you kill him.
Nope, I'll keep going even if I kill him.
Got it.
Start counting. How many?
26.
Okay. Either you suck at math, or you're gonna die in 2 seconds. You suck at math. What flavored dwarfs are you guys?
My daughter and I both have cartilage hair hypoplasia. Think you can make a pun out of that?
Yes, but I don't want to be insensitive. She's got a bit of a short fuse, isn't she?
Some people bottle up their feelings, have them come out as physical pain. Healthy human beings express feelings such as affection by giving gifts.
Gifts express guilt. The more expensive the expression, the deeper the guilt. That's a $12 box. Either you haven't slept with her yet, or she wasn't that good.
His fingers are even darker, his temperature's 102 and spiking, and the x-ray now shows lung infiltrates.
Well, the good news is, you won't be bitching about losing his hand if he can't breathe.
How would you describe my leadership skills?
Non-existent. Otherwise excellent.
There's more to being a leader than being a jerk.
The world will never know.
We loaded him full of prednisone to try to fix the liver.
Good news is, he's running out of organs to fail. Oh, almost forgot. I need to give a 16-year-old magic mushrooms to treat a cluster headache. Is that cool?
No problem. I was being sarcastic.
Wouldn't look that way in the court transcript.
Assume you considered the father and ruled him out.
What's that saying? When you assume, you become a pain in the ass to me.
Why should I argue? You just overruled me.
Enough! Get a pony or a watermelon farm.
House. Thank you so much. I gotta get you a gift or something.
Sometimes the best gift is the gift of never seeing you again.
Okay, all right.
You must be Dr. House.
And you must be full of baloney. A lot of it.
Right, that joke. Always fun. Only people you can still make fun of.
And Christians. Oh, and black people.
Thank you very much. This guy's been working for me for a long time, and
I get bonus points if I act like I care.
Merry Christmas.
And a happy go to hell.
If she's never kissed a boy, it's a fair bet she's never had sex.
Tell that to all the hookers who won't kiss me on the mouth.
Arrogant enough to think that of the 50 billion galaxies, 100 billion stars per galaxy, and 10 million billion planets in the universe, that we're the only ones with life.
No. But I'm guessing we're the only ones who like shoving things through our back doors.
If Chase screwed up so badly, why didn't you fire him?
He has great hair.
What are you hiding?
I'm gay. Oh, that's not what you meant. It does explain a lot, though. No girlfriend, always with Wilson. Obsession with sneakers.
I just admitted a cartilage hair hypoplasia dwarf, 15 years old.
What are you gonna do?
I thought I'd get your theories, mock them, then embrace my own. The usual.
Are you being intentionally dense?
Huh?
Oxygen saturation is 94%. Check her heart.
Her oxygen saturation is normal.
It's off by 1 percentage point.
It's within range. It's normal.
If her DNA was off by 1 percentage point, she'd be a dolphin.
what is this?
He's not a what, he's a who. They even have the right to vote now.
He swallowed a magnet. We gotta cut it out.
How old are you?
8.
And he swallowed something stuck to a fridge. Darwin says let him die.
I've got the plague.
Don't worry, it's treatable. Being a bitch, though. Nothing we can do about that.
We've got rectal bleeding.
What, all of you?
Excuse me.
You stash your drugs in a lupus textbook.
It's never lupus.
I don't think this is lupus. So, it's infection, lupus, drugs, or cancer.
No. I think lupus is way more likely.
Treat him for lupus.
That will get you fired.
You really think House is losing it?
Yeah.
And it's not lupus.
ANA is negative for lupus. Again.
It could be an autoimmune disease. Lupus, Behçet's.
ANA for lupus, also negative. Lupus could cause...
No. Lupus progresses slower. There'd be joint pain.
So it's not a typical case. We should get an ANA.
It's not lupus. Has he responded to the latest lupus treatment?
He's only been on it for a few hours.
He hasn't responded because it's not lupus.
The IVIG made him worse. O2 sats plummeted.
So we know it's not lupus. What else could it be? Stool sample to check for parasites, blood culture to rule out infection, and ANA for lupus. Autoimmune, it's better than cancer. But lupus loves kidneys. Usually attacks them first. Kidneys are fine, right?
Yeah.
Vision issues plus screwy heart equals some type of autoimmune.
Lupus and Kawasaki's are the most common in a 6-year-old.
Yeah. Tough to find a 6-year-old who doesn't have lupus.
Okay, it's affecting the larger blood vessels. It's gotta be giant cell arteritis. I'll start on steroids. It's affecting the smaller blood vessels. Gotta be lupus vasculitis. I'll start on steroids. It's affecting...
Yeah, got it.
Lupus and Behçet's are our best bet. An ANA and a pathogen test.
Or it could be infection.
My memory is not what it used to be, but didn't we just rule that out 8 seconds ago? Parasites or fungus is possible.
Or maybe lupus. Your grandma has lupus.
Okay, autoimmune. I'll run a lupus panel.
That's even slower than MS. It's lupus.
I'm with the little man on this one. It's attacking the body and the brain. Classic autoimmune.
Flirt all you want, but I should warn you, shixes are for practice.
Lupus this aggressive wouldn't spare her kidneys.
Positive, it's lupus.
Weakly, not lupus. It's MS.
We obviously don't know what it is. Treat for both.
No, I gave in on the test. We're not treating her for two completely separate diseases because you think lupus will win you a prize.
Still think it's lupus?
Yeah.
Could be lupus. That's what we figured. Then why are you here?
Could be splenic sequestration, tuberculosis.
Gaucher disease, TTP.
Hemolytic uremic syndrome, sepsis, lupus.
Listing all the possible causes is only impressive if you can do it reverse alphabetically. Wilson found signs of inflammation in your biopsy. That plus the 2 failing kidneys points to autoimmune disease, probably SLE or vasculitis. Treatment for both is prednisone. Start with 100 milligrams.
Autoimmune's just your latest theory. Like cancer before that and a kidney stone before.
Take the prednisone. You'll get better. That'll be your confirmation.
Yeah, I trusted you.
You always trust me. It's a big mistake. Lupus is a bad diagnosis.
It's the best diagnosis we've got.
That doesn't make it good.
No. Just makes it this kid's only chance to live.
Actually, we've been trying to ignore that part of the whiteboard.
I wrote it in black. I'm always serious when I use black. Lupus would explain...
Maybe she didn't change.
Are you agreeing with me or are you making a point?
I'm making a point.
gonna take longer.
How do we know that the real Roz isn't who she is now and who she was then? Can't we say that her previous life was true without making her present one a fraud?
Life is messy argument. Nice. Explains everything without explaining anything. If it's lupus, there's a heart problem we don't know about yet. Run her through a stress test. If she has a heart attack, I'm right.
I don't think it's hepatitis. I think your son has lupus.
Heart's strong enough to prove you wrong about the change in mental status.
Only proves this isn't lupus.
They told me I have an autoimmune disease, like lupus or sarcoidosis.
That's what we're here to find out.
Lupus.
Gee, thanks for coming in.
We got a referral from...
Excuse me. You stash your drugs in a lupus textbook.
It's never lupus.
Have any relatives ever been diagnosed with lupus?
I don't even know what that is.
You can test for the antibodies. 95% of patients with lupus have positive ANA.
Not cloudy. Negative.
It can happen in lupus. Increased platelet count could cause blood clots.
ANA was negative. It's not lupus.
This is true.
Hallucinations are a symptom of psychosis, which is the 4th diagnostic criteria. It's official. This is lupus.
Who's Jules? Any mention of her in the medical history?
It doesn't matter what he's hallucinating about. It matters why. It's lupus.
There's no need to get snippy. Sore throat? Well, it's not lupus.
Phospholipid antibodies are negative, so no lupus. Same for Church-Strauss.
Autoimmune diseases can make antibodies go haywire, but still.
It's happened. Apparently, it's happened again. I finally had a case of lupus.